Officials at the Food and Drug Administration are taking precautions in the case of the current strain of bird flu, just in case it spreads to humans on a large scale here in the U.S. The FDA commissioner testified on Capitol Hill yesterday and claimed that while the threat to humans is low and dairy products are safe, agencies are working to shore up countermeasures. So far, there have been just 2 documented cases of human infections in the U.S., one from exposure to dairy cows and the other following exposure to poultry. So joining me now is Dr. Céline Gounder. She is the editor-at-large for public health at KFF and a CBS News medical contributor. Good to see you again, Doctor. So the bird flu, as this story sort of develops, how concerned should we be? It doesn't very frequently jump to other species, but we are seeing it now in cows and a couple of people.
So from the perspective of the food supply, so dairy products, beef, preliminary testing has shown that the food supply is safe. We have seen viral fragments, so pieces of dead virus in the milk, but that doesn't mean that it's actually infectious to people. What we're seeing is that pasteurization is working as intended to kill the virus in milk. But this is a reminder that raw milk, unpasteurized milk, is not safe. It is not healthy, as some people would claim. It is highly contaminated with bacteria and viruses, and this is why we pasteurize milk.
And so if there are people out there that should be particularly careful, maybe, avoid unpasteurized dairy products, is it kind of the usual people, the very young, the very old, people who might have pre-existing conditions, that kind of thing?
Well, especially the very young, the very old, immunocompromised people, pregnant women. But big picture, raw milk can be really dangerous for anybody. Even if you're a young, healthy person, you can get all kinds of bacterial infections and viral infections that way.
So the Food and Drug Administration has been doing a lot of testing of food products. What foods are safe to eat right now?
Well, really, all of the food except for unpasteurized dairy products can be considered safe based on the testing we've seen so far. I think, just expanding the conversation a little bit, I think a lot of the focus has been on dairy products and beef, but bigger picture, what concerns us is how is the virus evolving in domesticated animals, in mammals, and is it evolving in a direction of being more likely to infect people? Is it more likely to transmit from person to person at some point? That's what we're really worried about. And while we don't think that's an imminent danger, that this is going to happen tomorrow, this is the kind of thing we could be nipping in the bud now before it turns into the next pandemic.
Yeah, I think after what we've all gone through in recent years, we're particularly sensitive to this sort of thing. Dr. Céline Gounder, thank you very much.